Hi folks, thank you for joining me today. This is probably my third video in a row on the topic of engaging in therapy. There's just one more thing I want to throw out there, and it's really to challenge your motivation on seeking out a therapist. Again, this is to probably save you a little time, a little money, help you be more productive in getting things in order. But your motivation, what would be a motivation to seek out treatment? Well, let's start with the worst motivation, is to game the system. Seen that time and time again, where a person wants to come in, they already have all the symptoms listed out, they've researched it, they can cite verbatim the criteria for a diagnosis, and this is what I have, put it in my record so that it looks good for me if I want to get disability payments, not Social Security, some kind of compensation, prove to my job that I have this disability, whatever it might be. It's to gain something. It's to prove to the court system that, yes, I actually have a mental illness, so don't send me to jail, send me to rehab or something like that. So I've seen that time and time again, and if that's your motivation, is to gain something extra out of it, it's pretty easy to pick up on. You might get a therapist and we'll go along with it. Okay, so what diagnosis do you want? Yeah, we'll put that down. I mean, it's out there. There's people out there. I've come in contact with a few of them, and that's just totally unethical. I mean, we're not doing anybody any good going that route, but you know, you can be found out pretty easily about that, and then once it gets marked in your record that, you know, you're faking things or fabricating symptoms, things like that, that gets into your medical record, and that can follow you pretty much for the rest of your life. So just word of caution for that. But other motivations, if your motivation is to go and complain about others, complain about situations you're in, I don't know if you'll find much benefit. Yeah, the therapist will be there to listen, but there's not much change that's going to happen because it's all external. Everybody, all the situations are causing problems. You and a therapist sitting in a room is not going to make those situations go away. So, you know, checking why am I going into therapy? I think one of the better motivations, or at least a prompting that will start getting you on a better track, is asking the question, what is it about me that needs to change? Or even starting with, am I ready to change? Because if you go to therapy, it is going to be about you. It is going to be about the way you think about things, the way you view things, the way you behave. And that's the only thing that you have responsibility for, is yourself, right? And so the focus is going to be on changing yourself. We can't change a spouse. We can't change your boss, you know, things like that. But the focus will be on, are you ready to make changes for yourself? And so as you're contemplating going to therapy, are you ready to make changes? You may not know what that's going to entail. You may not know what the focus is going to be, but are you at least open to saying, yes, there's obviously I'm not handling things well. I can't deal with things. I'm stressed out. I'm super anxious. I can't get motivated, whatever it might be. So if you start saying I, that's a good start, because now you're saying I'm kind of acknowledging things aren't well with me and I need to make some changes in my life. So that motivation to change. If you're not ready to change, you're probably going to waste your time going to a therapist. If you're ready to go into therapy and point the finger at everybody else and the world around you, you're going to be wasting time and money. So before going and making that call to a therapist, you'd want to question your motives. Am I ready to take some steps, different steps, to make things better in my life? And if you've kind of come to that reality, then good. That's a good step to moving forward in life. Motivation to make things all better. Oh, that's a fantasy. I get that a lot from patients. They want a perfect world. They want no problems in life. They never want to experience sadness or an anxiety moments there, and that's unrealistic. There's no magic wand. There's no bubble we can put you in to protect you from all that. And so, those expectations of I'm gonna go into my therapist and tell him everything, and everything's just gonna be all better. And that's just not the case. Ideally, if you had a specific goal, if you had a specific problem in mind that you wanted to address, that's probably where you're going to get the most bang for your buck, because now you've thought about it, you've honed in on this is the problem area in my life, and I just need a little guidance on how to take some steps to work through this. I think that would be the most bang for your buck. If you go into therapy and my life's a wreck, I never make any good decisions, from childhood on up, everything has been horrible, you're probably going to spend a long time in therapy, and you might not, you might not get the max benefit from it as if you were very directed in what you're trying to figure out. So those unrealistic expectations definitely need to be challenged before seeking out going to talk to someone. There was one more thing I was thinking about for expectations. Maybe the expectation of the therapist is going to fix you. They're going to fix you. Again, that's not. They might see you 1 hour a week, 1 hour a month. Really, that's not much time to really interact with you. The work is going to be done in your real life, in your normal everyday life. The therapist may give you some advice, some tools to apply when you're out in the real world. That's where the work is going to take place. Not so much the 1 hour a week, everything's going to change, and then you leave the therapy session and, oh boy, I got a new outlook on life, everything is going to be great. No, it's going to take work and some time and putting some things into practice. So that belief that this person will just fix me, or they'll give me the magic answer, or just the perfect way to do things, that's unrealistic as well. Going back to having a very specific goal, a very specific problem, one of the things you might not know is the therapist gets paid for you coming. Okay, now I'm not going to say every therapist has ill intentions, but if you don't show up, if you don't come, they don't get paid. And so it can be very easy for a therapist to think of issues to bring up that can keep you coming. We all have issues. We can all point out things throughout our lives that didn't go well, or I wish I can change, or whatnot. If you're very general about that going into therapy, again, you can be there a long time, and I don't think it's going to do you any good. So if you come in and you have these general complaints, broad complaints, that therapist can keep you coming in for week after week after week. And you know, that some therapists need that income, is all I'm gonna say. Not all of them, but some need that income. So, you know, oh well, next week let's talk about your childhood, or you know, so we've solved your anxiety issue. You're doing better with the anxiety, but oh, now we gotta work on, you know, your anger, or your impulsiveness, or I mean, you can keep picking things. That's how we are. That's how people are. And so, you know, I don't think that's a good use of your time. I would say the most important thing that's happening, try and be as specific as possible with what you want help with. Get in, hash it out. May take one or two, couple sessions, and get out. So I think that's all I have about motivation. If you have any comments, questions, put them down in the chat box there, and I'd be happy to answer them. Look for more videos to come on this type of topic of therapy, and I will catch you later. Thank you.